Hello and welcome. Today I am going to talk about one of the most common complications of overweight and obesity, which is hyperinsulinemia and insulin resistance. I mentioned last video that overweight and obesity will lead to a serious condition called hyperinsulinemia, which is higher level of insulin in the blood all the time because of weakness of the insulin function. Now, let me just shine a light quickly on the insulin role. As you know, insulin is a hormone usually secretes from the pancreatic gland in response to high glucose level in the stream. It will work as, or it works, I should say, it works as a key to facilitate the entrance of glucose inside the cells. So it can be used in metabolic process and eventually produce energy to our body. Now, what happened over time because of inflammation, certain factors that I'm going to talk about later on, certain organs will face resistance of the insulin function. Because of that, the insulin will not be able to facilitate the entrance of the glucose inside the cells for energy and other process as used to be before. Because of that, the glucose will go higher in the stream, and the pancreatic gland will respond to that by secreting more insulin. So now we're dealing with two different scenarios: higher insulin level and then higher glucose. That will lead to feel more hungry. So the patient will eat more just in response to the craving of sugar and the insulin role. Insulin, as you know, will when it's higher in your system, will make you feel hungry. So you eat more and eventually more glucose in the system and more secretions of insulin from the pancreas. So we end up dealing with higher insulin, higher glucose. That will eventually turn on to be fat in our body, deposit everywhere, especially in the central area, and will lead to more obesity and more problem. This is going to be a viscous cycle. So if the patient suffer from this kind of situation, it will be very hard to break it down unless start taking medication and changing completely the lifestyle. Now, if we talk about what are the major factors and reason for insulin resistance to happen, simple stuff. Talk about the genetics, family history of obesity, overweight, or diabetes will definitely make the person have higher chance to develop hyperinsulinemia and insulin resistance, and then later on diabetes in the future. Smoking, high blood pressure, high cholesterol, sedentary lifestyle by not exercising a lot, aging, of course, aging with when getting older, everything will start slowing down and more problem the function. One of them is the insulin and the insulin resistance. Sleep disorder such as sleep apnea or insomnia, um, higher level of stress and high cortisol level. That would definitely work against the good function of the insulin and will lead to resistance. Smoking for sure. Pregnancy in the second and third trimester, they tend, and certain people actually tend to have some resistance to insulin level. That will eventually lead to gestational diabetes, which is a common condition that's required to start taking insulin to avoid complications later on during pregnancy. This kind of things definitely will finish at the end of the pregnancy, but the tendency to develop a diabetes, pure diabetes in the future within 5 to 10 years will be higher than normal population if the patient don't pay attention to the quality of diet and the lifestyle and exercise that they do in their life. Okay, now Let's move on to how to diagnose this kind of situation, or the symptoms, I should say, first of all, that will present because of hyperinsulinemia. Uh, Generally speaking, if somebody with overweight and obesity start having headaches, blurry vision, dry mouth, frequent urination, especially at night, fatigue, bloating, feeling tired after meals, certain skin problems such as acne, skin tags, pigmentation, certain part of the body. This kind of thing actually might be like a warning shot for something going on. That will trigger the person to go to his family doctor that usually is supposed to start who is supposed to start investigations to see what's going on. In normal situation, most doctors will order fasting glucose and A1C. Some of them they add the insulin level as well, which is, in my opinion, very important in this kind of situation. Now, if the patient doesn't want to fast, it's okay to order random glucose. And in situation like pregnancy, for example, you can do the glucose tolerance test, which requires to take 50 or 75 grams of glucose, and the glucose level will be checked before taking the liquid, and then 1 hour and 2 hours after that, and based on the results will be determined if there is gestational diabetes or not. Now, I'm not going to talk about the numbers here because, again, this video not actually targeted to a specific country, it's everywhere. So I'm just gonna talk about one of them is A1C, for example. So the normal A1C between 4.5 to 5.4 would be acceptable. That's considered normal, not really concerning. Now, any level between 5.7 to 6.4, that's considered pre-diabetes. And anything 6.5 and greater than that will be pure diabetes. So that's the basic test that should be ordered. Insulin definitely when it's high, when it comes back high, definitely means a lot for the treatment and the way we approach this patient. All right. So avoid long video, I will stop at this level. Hopefully, in my next video, I'm going to talk about the diet that will advise every single person come with these kind of symptoms and situation. Will be focused on the lifestyle modification, the way you eat, adjusting the eliminating the bad habits and adjusting the way you choose your food and meals, and then the quality of exercise that will recommend actually to improve the insulin resistance. And definitely we can just briefly talk about certain medication that will be good for weight loss. Thank you for listening. I will talk to you next time.